lipids and lipid profile. First of all, just we have some explanation about lipid. You recently learned what they are, what kind of lipoprotein we have. I quickly review them and then we will go about the experiment. And please pay attention to the experiment and learn everything here. Then when you go to the lab, do not ask and behave like someone you don't know anything about the experiment. So today we have four tests. Three of them you will do, and the fourth one you will calculate. Finally, you should report 5 numbers. And what they are? The concentration of triglyceride, concentration of total cholesterol, concentration of HDL cholesterol, LDL cholesterol, and ratio of LDL to HDL. So I need these 5 numbers. And what they are known as a lipid profile. You know about the characteristic of lipid. They are water insoluble. They can act as an insulator. We have a different classes of lipid. Some part of lipid are present in the plasma. Among them, triglyceride and cholesterol are much more important. And you know these lipids are located inside lipoprotein, like HDL, LDL, and VL. So, related to the deficiency, we learned we have some disease. They actually can be occurred due to the lipid disorder. Diabetes mellitus, obesity, metabolic syndrome, atherosclerosis, chronic heart disease, all of them are related to the lipid disorder. And actually in the future, you as a medical doctor, all the time for most of your patients, you will order the lipid profile. And you should know about the interpretation of the data and what they are. Because mostly, for example, for more than 90% of the people, we use the lipid profile for evaluation of their actually healthy for cardiovascular disease, for diabetes, for obesity, for metabolic syndrome, and other kind of diseases. So we learned based on the density, we have 4 main kind of lipoprotein. Chylomicron, very low density, and high density. Among them, high density and low density, they carry cholesterol. LDL transport cholesterol from the liver to the tissue, and HDL vice versa. Transport cholesterol from the tissue to the liver. And what is the final product of metabolism of cholesterol? The final product of metabolism of cholesterol. In the liver, we convert cholesterol to what? Bile. We convert cholesterol to bile, and then we excrete cholesterol as a form of bile. So the excretion form of cholesterol in our body is bile salt and bile acid. And as you know, just 25% of bile will excrete in the feces, and 75% will be absorbed to the liver. So you learn about their structure. The chylomicron are so huge, and the HDL, they are so small. And also we have VLDL, IDL, and LDL, which in the blood circulation we have all kind of these lipoprotein. They contain phospholipid, cholesterol, triglyceride, cholesterol ester, and apoprotein. Because you learned them, just I passed, and we have a 2 term, bad and good cholesterol. Good cholesterol is due to that it's decrease the amount of cholesterol in the tissue and decrease the risk for atherosclerosis. Protective against chronic heart disease and cardiovascular disease and brain stroke, because decrease the amount of cholesterol. And LDL because lead to the accumulation of cholesterol in the tissue known as a bad cholesterol. In the theory part, actually I mentioned about their value. for the normal range of HDL is between 40 to 80. Okay? It's between 40 to 80. So when you do the test for HDL, you should get this number. Maybe it be less than 40, but a little, 30, 35 like that, or maybe more than 80, 85, 80. But some students yesterday, they bring me 0.04 for HDL cholesterol. So you should understand this number is wrong. It should be between this number, 40 to 80. Or lesser, for example, 5 or 10, less than 45 to 10, more than 80. Not 0.004. It's not logic. You should understand that as a medical doctor. Someone in the future give you the lab result, and you should understand what is this lab result, the meaning of the value. And the unit is milligram per deciliter. For total cholesterol and triglyceride, less than 200 is good. Okay? Less than 200 is good. But maybe it be more than 30. But triglyceride cannot be 001 or 01 or 1 or 2. But sometimes some diabetic patients, some obese people, their triglyceride may be more than 1,000, maybe more than 2,000. It's known as a critical value. Okay, for triglyceride we have this. For total cholesterol, is less than 200 and more than 40 to 60 to 200. But sometimes someone has near to 300, 400. But we don't have total cholesterol 1,000, 900 like that. Okay? And finally, related to LDL, the best value is less than 100. If we go do the test, all of us, our LDL is between 60, 50, 60, 70 to 90 or 100 is the normal value. But for those patients, they have a high risk for atherosclerosis is more than 120, maybe more than 190. But it can't be less than 20, less than 10, the LDL measurement. Okay? It was related to LDL. So you should know the value. When they give you a number, you should know this number, it can be wrong or it can be correct. So based on 120 for LDL and 40 to 60 to 70 for HDL, the ratio of LDL to HDL less than 3 is the best value, is a normal situation. Between 3 to 5 has a medium risk for atherosclerosis. And more than 5 has a high risk for atherosclerosis. So after doing the test and reporting the total cholesterol, triglyceride, LDL, and HDL, you should calculate the ratio and finally report that is a normal person or has a medium risk for atherosclerosis or has a high risk for atherosclerosis. If I saw you actually report and you don't mention that, I give you negative again. Because yesterday, 5 times in the class I mentioned, and at the end of the class no one didn't mention it again. One by one I explained. So here you should understand what I'm saying. And if you don't understand, you can ask Tara to help you write no, understand everything. When we go to the lab, also I need to do some another actually teaching to other people. So I will talk about the procedure and you will learn them here. Because I take a photo, I asked Dora in the previous